Step 53, consents for frozen embryo transfer cycle. Before doing frozen embryo transfer cycles, you need to sign certain types of consents. Staying on top of your consents is very important, because the not having valid consent at the time of starting of the cycle is one of the main reasons for the cancellation of your cycle, which can be very frustrating. That's why it's very important to understand what kind of consents you need to sign, and so that you can track whether your consent is valid or not before you start your frozen transfer cycle. Generally, there are two different types of consents. One is a regulatory consent, second is financial consent, and some clinics may have different types of consents. The regulatory consent is defined by the regulation of your country. So each country has got the regulatory body which regulates storage, utilization, discarding, and posthumous use of frozen eggs, sperm, and embryos. So your consent reflects the law of your country. Very importantly, you should understand that embryo is a property of yourself and your partner, and both of you need to give a consent whenever you want to use the embryo, or whether you want to discard the embryos. Essentially, when you sign a consent for frozen embryo transfer cycle, both yourself and your partner needs to sign. Financial consent involves the itemization of your what you need to pay for during frozen embryo transfer cycle in terms of your consultation fees, cycle fees, test fees, procedure fees, and lab test fees. And also you should understand which of these fees are included in your cycle fee, and who will be paying for those fees, whether you're going to pay yourself out of your pocket, or whether it will be included to your government public health insurance, or whether you need to use your private insurance. Then other types of consents are specific to the clinics, and also if you have a frozen embryo in different clinic, if you want to use that embryo in frozen cycle, you need to transport that embryo to the clinic where you're undergoing treatment, and for that you need to sign special transportation consent for your embryos. It's very important to have your own checklist to understand which consents are applicable to you, and whether these consents have been completed before you start your frozen cycle. And also you should know when you should update your consent. Some consents need to be updated periodically, let us say every 6 months, every year, and some consents expire after each cycle. So you need to know exact day of expiration date for your consents, and how often you need to update your consents. Understanding of the consents is very important from logistical point of view, in terms of reducing your stress on the day of starting frozen embryo transfer cycle. If you're not sure, send a short email to your clinic and ask what consents you need to sign before starting frozen embryo transfer cycle.